Hi, I'm John, first year student radiographer from Merritt College, and my clinical site is at Summit, Oakland. And today we'll be discussing a little about cholesterol difficile, also known as C. diff, and the proper precautions to take when dealing with a C. diff patient. C. diff is a contact disease that attacks the intestines of the patient. Antibiotics disrupt the normal flora in the GI tract, and then spore-forming bacteria will actually release toxin into the patient's bowel. It is very resistant to disinfectants. It is also spread by hands, and C. diff can cause anything from diarrhea to pseudomembranous colitis and sepsis. C. diff is a contact organism, which means it is transmitted through direct or indirect contact. And with that said, I will show you the proper precautions that Summit Hospital uses when dealing with a C. diff patient. And it consists of these gowns here, a gown, and gloves. Okay, so I'm going to show you guys how to properly put on your personal protective equipment for a C. diff patient. Again, it consists of this gown and some gloves, okay? I just want to open up your gown up, slide your hand in the holes, and it opens up in the bag, just kind of like a patient's gown. Just gonna slide that in there, and notice there's a stretchy tightening around the wrist. You want to go ahead and start off by tying the around the neck first. Give it a nice little loop. Go, and then you go on down here and you tighten up the waist. And this will prevent any kind of contact onto the person. So you want to put your gloves on, and make sure your gloves go around the waist, the wristband here. That way nothing comes in. And voila. Okay, now that I have my PPE on, we're gonna go do an examination on a C. diff patient. We're just gonna do an AP upright chest X-ray on her. Notice that I am using a portable machine and that I have a lead apron on. Seeing you do your chest exam today, okay? So take a look through your wristband, please. Thank you. Is there any chance of you being pregnant, ma'am? No. Alright, I'm just gonna place this lead apron, lead shield over your lap here, okay? And I'll sit you up just a little bit. Alright, how's that? Okay. Remove this pillow from behind back. Also notice that I will be placing the cassette behind the sheet so it doesn't come in direct contact with the patient. And although the cassette is not in direct contact with the patient, it will still need a complete wipe down with a bleach wipe. Really great. Okay, we give you a few breathing instructions in a minute. I'm going to need you taking a deep breath and then hold it for me, okay? Can you do that? Okay, go ahead and take in a deep breath. Hold it. Go ahead and relax and breathe. We're all done here. Gotta take this from behind your back. Back. I'm now going to show you the proper way of removing your PPE. So first off, with your dirty gloves, you can just grab hold of this and just kind of pull away.
These gowns are a little different from the ones at Summit, so you'll see me struggle a little with this one here.
Kind of pull that away and have that out, just like that. Kind of do that, and then you want to roll it away from your body, so you don't get any of that stuff. You're not flicking it back onto your face. Toss that. And with the gloves, just grab it from the outside here. Just roll it up. And then you can either use your glove or just with the clean hand here, just stick your hand inside underneath the glove and just peel away. And dispose of that.
After an examination on a seated patient, you want to make sure you wipe down everything that you touch, including the portable, the buttons on the portable, the shield, the cassette.
Just wipe it down really well, just like that. And you will also want to wipe down the cassette you use, complete wipe down, like a complete wipe down. Just wipe it all the way down as well as you can. This is bleach wipes, by the way. Once you've done
After
that,
you wipe everything down, make sure you wash your hand thoroughly with soap and then dry.
Shield that came in contact with the patient, just wipe it completely down.
Well, we spilled out into the streets. There were stolen cars.
Hi, my name is Jessica. I am a student radiographer at Merritt College. I am currently doing my clinicals at Doctors Medical Center. Today I'm going to be doing a KUB projection on a patient with chickenpox. Now, chickenpox is a highly contagious skin disease. It is caused by the varicella zoster virus. It is red, it's a rash. It's red, itchy, has blisters, and it can last from anywhere from 5 to 10 days. Some other symptoms may be fever, tiredness, loss of appetite, and headaches. Now keep in mind that chickenpox is an airborne disease, which means it is transmitted through microbes that have spread on evaporated droplets, and they're suspended in the air, which means that anybody can inhale this. Because of that, there's a few extra precautions that we have to take on top of our standard precautions. One of them is that the patient does remain in a negative air pressure room. Another one is that when transported through the hospital, he has to be wearing a mask. For us, we would be wearing a gown, gloves, and then an N95 mask. Okay, this one's the one that I use in my clinical. And then I'll be discussing the proper use and disposal.
David?
Yes.
Hi, David. Can I check your wrist real quick? Okay. Can you follow me to say?
Sure.
Can you tell me a little bit about what's going on?
Just been having like sharp pains. I've been throwing up.
Okay.
Just feeling really sick.
Okay. Now do me a favor and put your back against this. Thank you. Okay, now I'm gonna touch your hips a little bit, okay? Is that okay? Can you move a little bit over with me? Stay still, okay? Okay, so I'm gonna ask you to breathe in and let it all out and hold it. Now hold it, and relax. Thank you. Hey David, did your doctor give you any extra
No, I'm
instructions
just
or
gonna go
anything
home
like that?
after this.
Do you know how to get out of here?
Yeah, I do.
Okay, make sure you keep that mask on, okay?
Okay.
Take care.
You too.
Okay, this is the proper way to dispose of your PPE. So I'm going to rip this off. So I rip the neck off first, and then I rip the waist off. Make sure to not touch the inside. So then I'm gonna roll it off. Along with my thing, I'm gonna take off my gloves. And so the outside of the glove is out. And I'm gonna roll the outside up. So I'm only touching the inside. So throw that away, and then I'm going to take off my mask. Once you have all your PPE off, you have to wipe everything down. So I'm going to put on some new gloves so I don't get contaminated. So and I'm going to wipe everything down, everything that I touched while the patient was here.
I may be a little dull
That's it.
and gal of yours. That's when I'm straight sober and both feet are on the floor. But sometimes when the booze grabs a hold of me, I get the devil in my eyes and I'm running.
Hello, my name is David. I'm a first-year rad tech student at Merritt College. I'm currently doing my clinical rotations at Washington Hospital in Fremont, California. Today, I'm going to show you how a radiographer protects themselves from an infectious disease while conducting an X-ray exam. Today, we will be conducting an exam of the wrist on a patient who happens to have the measles. Now, the measles is a respiratory disease caused by a virus that dwells in the lungs and in the cells lining the back of the throat. It's highly contagious because of its ability to spread through the air by coughing or sneezing. In addition to being an airborne pathogen, it can also live on surfaces for up to 2 hours. So if your patient was to sneeze or cough on their bed rails, doorknobs, etc., that virus may be living on that surface for up to 2 hours. Symptoms associated with the measles are a high fever, coughing, sneezing, a rash that covers the body from head to toe, and in some serious and rare cases, pneumonia and even encephalitis, which is swelling of the brain. Luckily for us as radiographers, we have some tools at our disposal that are going to protect us from contracting the disease while we're conducting our duties as a radiographer.
Okay, so our tools for protection is as such. We're going to have a gown, because as I stated earlier, not only is measles airborne, but it can also live on surfaces for as long as what? 2 hours. So we're going to put this gown on first.
Okay, so I'm going to start with tying the top straps first, and then I'm going to tie it around the waist. Now you're going to see me struggle here for a bit. Some techs actually tie the top straps first, and then slip their head in between. Makes it much easier and faster. So as you can see, that probably would have been a better way for me.
Next up is the mask, an N95 mask in particular, because this stops 95% of airborne particles and organisms from entering your mouth or your nose. So first things first, you're going to tug this down a little so it gets around your chin. You're going to pull on these straps. One strap over here, one strap over your ear. Make sure everything is nice and snug. If there's any opening, there's an opening for that measles. Last but not least,
When you're putting on the gloves, make sure that they cover the cuffs of the gown. This is what I ensured. At the end of the gown, the cuffs are white, so it's easy to see. You put the blue gloves right over it.
from this point, you are ready to do an examination on your patient.
Yes.
How you doing?
Okay.
Okay, my name is David. I'm a student radiographer from Merritt College.
Okay.
We'll be taking a couple pictures of your wrist.
Okay.
Can I take a look at your wristband?
Sure.
All right, come this way with me. So what happened to your wrist?
I fell and I caught myself, and I just kind of
Have a seat for me
bothering
first.
me now. So thought I'd come in, do an X-ray. I'm afraid it might be maybe a fracture or something.
Fracture?
Yeah, maybe.
Okay.
I'm not sure. That's why I'm here.
And when did this happen again?
This morning.
This morning?
Yes.
Okay, can you move it any much?
Yeah,
or
just a little bit.
just a little?
Yes.
Okay, well, I'm gonna position your wrist.
Okay.
If I do something that hurts you, you let me know right away, okay?
Good. Let me put your
This on this plate, right in the middle. You're doing so far so good. Can you curl up? Are you able to curl up?
Yes.
Ah, perfect. You got more motion than that. I'm gonna have you put this shield right here. Protect you. Thank you. This is just my marker right here.
Okay.
All right, I need you to look away. Relax. Take this plate aside. Did your physician give you any other instructions
No, just after the X-ray, just wait for
for the results?
results.
Okay, do you know how to? Okay. Do me a favor. Don't take your mask off so long as you're here. Okay.
Okay.
All right.
Thank you.
You have a good one.
You too.
Okay, so when I'm taking the first glove off, I'm pinching it off, and then I'm using my good thumb, slipping it underneath the other glove. Take it off. I'm putting my hand underneath the gown, the unaffected area, and I'm going to be rolling the gown away from me. And then I'm going to discard it. Last but not least is my mask. And now I'm going to put a pair of clean gloves on because now I'm going to disinfect every area that either I or the patient touched. So I'm cleaning up the shield. And I'm going over to the image receptor. Definitely the tube, any area there, any crevice. Even the chair, the handrails of the chair. I'm going to discard all of that. I'm going over to the control panel now. Wiping that down as well. And I'm going to utilize the same method earlier, pinching the first glove, using the good thumb, rolling it out,
with soap
and
and
I'm
water,
good to go.
drying off, and I'm good to go.
I was born in a dusty cloud, fragile and free at the edge of sound, and that's all